Hi, my name is Amberlyn Roush. I am a registered nurse. I have my bachelor's degree in nursing and I'm a certified foot care specialist. I am the owner of Foot Wellness Academy. This is a course for registered nurses who want to open up their own mobile foot care business. This is great for someone who just wants to make extra money, or this could possibly be your full-time business. You might be retiring and you just want something that's more at your pace. Or if you have small children and you want to get them off onto the bus before you go see your patients and then have your patients done before you have to pick them up off the bus. This gives you the freedom to do that and to utilize your license. Especially maybe you wanted to be a stay-at-home mom even, but you didn't want to completely have no income and you didn't want to be structured to be for sure at the hospital for a 12-hour shift. A lot of times you would work half the time and you would get the same amount of money as if you were working a 12-hour shift by just taking care of like 5 patients a day. It's really cool to be able to have that option and be in control of your time. So I actually decided to start this business after I was advertising my own mobile foot care business and it went out to different states all over the United States. I got calls saying, my wife really needs foot care. She's in mobile, and another person said, my mother needs help. And I said, I'm so sorry, I don't provide that. But then I thought, what, this would be great to engage the right nurses to take on those foot care needs and be another option for them to be able to call on if they need help. When I put the academy together, I had other nurses in mind. I'm trying to reach every community, every city there is to at least have 1 to 2 mobile foot care nurses there to take care of people's feet who may be in need. Whenever I started, I didn't have many people to help me along. I learned what I needed to be successful in taking care of feet, but I didn't know how to put the whole business aspect together. I didn't know the business structure. And so I basically lay out my blueprint to teach you how to start your own business. And then after you take the course, you'll be able to go out and start getting your own clients and feel confident enough to take care of them successfully. With your RN license, this is considered ADLs, as long as you're trained enough where you feel comfortable taking care of people who may have diabetes or circulation issues. They might not want to go to the salon. And then a lot of times podiatrists are not taking care of routine foot care where you can come in and take care of that safely. Some people are just not able to cut through thick nails and they might have long toenails. Sometimes the nails get caught in the carpet and that would increase their risk of falls. Or if their nails are extra thick, it could cause pressure inside of the shoe, which can cause pain or an open area. A lot of people are really embarrassed to get this taken care of. And so this is more of like a discreet way for you to go in and take care of them. It's important that your community knows that you are someone that could be a person that they can rely on or call on if they're immobile or they're not able to take care of themselves. So I offer 8 modules in the Foot Wellness Academy. One is structuring your business. We'll talk about logo and the psychology behind it. We'll talk about foot care terminology. And then module 2, we'll talk about foot care basics or fundamentals. This includes the anatomy, any assessments, charting, and then we'll even go over the checklist of supplies in the beginning, just so you start thinking about that right away. Module 3 is on the high-risk foot. We'll talk about the diabetic foot, circulation issues, any diagnostic testing, common foot deformities, and compression therapy. Module 4, we will discuss routine versus conservative and advanced foot care. This will help you know the common nail issues and what you might need to send out for advanced foot care. We'll talk about tools and tool techniques in Module 5. Module 6, we'll talk about infection control and safe foot care. Module 7 is on patient education. And I will actually share my PowerPoint with you that I share in the community. So whenever I teach on foot care, issues, I have a PowerPoint that I bring. And so that took me a long time to put together. And so I do share that with you so you can make that your own. And so whenever you're educating and sharing what you do with people, it'll make it a lot easier for you, especially when you're just getting your name out there. Module 8 is essentials for mobile foot care. So we'll talk about what you need for your bag, what to charge, how to market your business. I'll even provide templates for you to just shove your logo, your name, your telephone number, and all that information in there as well. And then I'll share videos with you while I'm taking care of patients, different nail issues, and even a video that's just start to finish on exactly what I do. And I do provide bonuses in there, even like a phone script, what you would talk about whenever you get a phone call asking about your services. So I try to make this as easy as possible for you so you're not questioning or waste hours and hours trying to put stuff together, because it did take me hours when I did first start this myself. So this will give you the opportunity just to get to work as soon as you're done with the modules and get your hands on people to start feeling comfortable taking care of foot care issues. So I actually have 2 options on ways that you can take the course. I have one option, it's called the accountability option. So this is an option where you take a 6-week course. I release a module one day of the week and you take that at your own pace. So then we'll go over any questions that you may have on that module for that week. And then the next week, again, I'll release the module to you. And so it will go on for 6 straight weeks. You really work at it on your own pace, except whenever we meet via Zoom for about a half an hour to an hour. And I'll go over any submitted questions so that you feel like you have that accountability to be able to have someone there for those 6 straight weeks. And then of course you can email me with questions if you really need to as well. And then the other option I have is where you just basically take this course at your own pace. You really won't have me there to guide you or to answer questions right away, but you can reach out to me after you take all the modules and I will meet with you 1 to 2 times on Zoom to go over any questions that you have before you go out there and start, or if you wind up feeling like all the questions were answered or you found them and you just wanted to ask me questions down the road and meet up via Zoom. So everyone's different. Some people want to, be as fast as they can, get through the modules and then start as soon as they can, or other people might just want to take as long as they want. And so I do have it available around up to a year, so you can just come back to it as necessary to make sure that you get all the information you need. If you feel like any of these options would work for you, you just go ahead and go to www.footwellnessacademy.com. So I was hoping if this does speak to your heart that you would really pray about it and really think about, is this the right opportunity for you, and to incorporate it in your life and to make a change in your community. This is something that a lot of nurses don't even know that they can do. I know when I first started the business, someone called me saying that she was praying for this for 20 years because her dad was a fall risk. It was so hard to get him out of the house, to get his toes taken care of. And then by the time they got the bus and co-pays, they said, I definitely would rather pay you and even more than that. And they were so thankful for the service that was offered. And so I know that there's so many people just waiting for you to say yes to this opportunity and to start your own mobile foot care business. If you have any more questions, feel free to reach out to me. I would love to answer any questions that you may have.